You've probably heard of it. Maybe you even know someone who has it. It's a condition that often creeps up slowly over many years. But what in the world is chronic obstructive pulmonary disease, or COPD? Well, let's break down exactly what you need to know about this incredibly common and serious lung disease. Right out of the gate, let's start with a really staggering fact. COPD isn't just some chronic illness people live with. It is the third leading cause of death worldwide. That single statistic really puts into perspective why understanding this is so important.
So what exactly is this disease with the really long name? I know, chronic obstructive pulmonary disease is a real mouthful, but the concept behind it is actually much simpler than it sounds.
Probably the best way to wrap your head around COPD is to think of it not as one single thing, but as a big umbrella. Under this one name, COPD, you'll actually find a whole group of lung conditions that are slowly getting worse over time, and they all share one big problem. It's persistently hard to get air out of the lungs.
So, what are the main conditions huddled under this umbrella? Well, you've got two big players, chronic bronchitis and emphysema. Chronic bronchitis is what doctors call it when you have that classic, long-term cough that produces mucus. Emphysema, on the other hand, is about actual physical destruction. The tiny little air sacs in the lungs are being damaged. And just to make things interesting, sometimes you see a patient who has features of both asthma and COPD.
Okay, so that's the what. We know what COPD is, but how does it get started in the first place? Let's dig into the main cause and what kind of damage it's actually doing inside the lungs.
You really can't talk about COPD without talking about this. While, sure, other things like air pollution or genetics can play a role, a jaw-dropping 85% of all COPD cases are tied directly to smoking. The connection isn't just strong, it's overwhelming.
So when someone is exposed to irritants like smoke for a long time, it kicks off this devastating chain reaction. You get chronic inflammation that just won't quit. This causes the small airways to get narrow and clogged up. At the same time, those delicate little air sacs get permanently destroyed. And to top it all off, the glands that make mucus just go into overdrive. It's basically a multi-front attack on your lungs' ability to do their job.
All that damage happening on the inside, eventually it's going to show up on the outside. So let's shift gears and talk about what this disease actually feels like for someone who has it and the classic ways it shows up in patients. There are three huge red flags to watch for. First, a cough that just doesn't go away, the kind people often brush off as a smoker's cough. Second, producing sputum or phlegm. And the big one is dyspnea. That's the medical term for feeling short of breath, a feeling that just hangs around and gets worse and worse over time, especially when you're active. If you see these signs, it's time to pay attention.
Now, when these symptoms start to get more advanced, doctors often see patients who tend to fit into one of two classic, though maybe a little simplified, profiles.
And they have these really memorable nicknames, the pink puffer and the blue bloater. The pink puffer is usually someone whose main problem is emphysema. They're often thin, constantly working hard to breathe, that's the puffer part, but they manage to keep their oxygen levels up so their skin stays pink. The blue bloater, on the other hand, is usually dominated by chronic bronchitis. They have that terrible, productive cough, are often overweight, and because they struggle to get enough oxygen, they can have a bluish tint to their skin and lips.
So, with these symptoms and these classic profiles in mind, how does a doctor go from just suspecting COPD to making a firm, definitive diagnosis? Well, the process is actually surprisingly straightforward.
I mean, really, how can they be certain it isn't just severe asthma or some other lung condition? How do they get to that point where they can say with confidence, yes, this is COPD?
While a lot of things can point them in the right direction, getting that final confirmation really boils down to the results of one specific, totally non-invasive test.
And that key test is called spirometry. It sounds complicated, but it's really not. It's just a breathing test. It measures two simple things: how much air you can blow out of your lungs and how fast you can do it. The magic number they're looking for is a ratio. They compare the total amount of air you can blow out to how much of that air you got out in the very first second. If less than 70% of the air comes out in that first second, even after you've taken medication to open your airways, that confirms it. It's the hallmark of COPD.
All right, so the diagnosis is confirmed. What now? This is where we stop talking about the problem and start talking about the solutions. This is where we talk about management. And honestly, this is where we talk about hope. Let's look at the path forward.
Now, this is probably the most important message for anyone dealing with COPD. Listen closely.
There is no magic wand to cure the damage that's already been done. But, and this is a huge but, that does not mean that nothing can be done, not even close. There are absolutely key things you can do that can dramatically change the course of this disease and improve survival.
So here they are, the 4 big interventions that are actually proven to help people live longer. You have things like home oxygen therapy for people with chronically low oxygen levels, and even surgical options like lung volume reduction or a full lung transplant. But look at what's at the top of the list. By far, the most critical one is number 1.
I really want to hammer this point home. The single most effective, most powerful intervention a person with COPD can make is to stop smoking. It is the only thing that actually slows down how fast the disease gets worse. It is the absolute cornerstone of managing COPD and living a longer life. Full stop.
Beyond that one massive step, managing COPD day-to-day is all about improving your quality of life. Things like pulmonary rehab can help you build strength and learn to breathe more efficiently. Medications, usually inhalers, help open up the airways to make every breath a little easier. Getting vaccinated for the flu and pneumonia is absolutely crucial to prevent infections that can cause really dangerous flare-ups. And finally, having an action plan means you and your doctor know exactly what to do when one of those flare-ups or exacerbations does happen.
You know, this quote really sums it all up perfectly. The very first step is just awareness. It's about connecting the dots. If the symptoms we've talked about sound familiar, or if there's a history of being exposed to risk factors like smoking, that's the signal. That's when it's time to consider the possibility of COPD and get an answer.
So, we've covered the cause, the effect, and the clear path forward for managing it. We've seen the risks, but we've also seen that there is real hope, and there are real actions that make a difference. So the final question is really for you. What does all this information mean for you today? What's one choice, big or small, that you can make right now for the future of your lungs?